Given the prevalence and negative consequences of violence in the workplace, a number of resources have been developed both provincially and nationally to assist individuals and employers in recognizing and managing it. This unit provides basic information on these resources. The Workplace Violence Prevention and Response Handbook, developed by AHS, emphasizes the importance of a respectful workplace and provides one stop for information, strategies, and tools to identify, address, and or report situations of workplace violence, inappropriate forms of communication, and working alone. The handbook includes copies of each of the AHS policies that deal with violence in the workplace. The handbook also provides risk assessment forms for use by employees generally, as well as by managers, to identify risks related to environmental hazards, specific patients, working alone situations, and home and community visits. Also included in the handbook are algorithms for reporting, responding to, and investigating violent incidents and threats. Finally, communications about visitor guidelines, the promotion of respect, as well as education materials and resources are included. All AHS employees, whatever their rank in the association, would be well served in becoming familiar with this handbook, which is available on the AHS intranet system. Also available through AHS is the Employee Toolkit to address bullying. This is a very user-friendly document which addresses the topics listed in this slide, including signs and symptoms of bullying in the workplace, a questionnaire, are you being bullied? Are you bullying others? How to address bullying and how to report bullying. The checklists for identifying whether the behavior of others or yourself constitutes bullying are a helpful resource. The algorithm describing the steps for reporting bullying is clear and informative. Also included are the links to several resources for employees, both within AHS and in the public domain generally. The Alberta Learning Information Service is a section of the government that is affiliated with Alberta Health, Alberta Community and Social Services, Advanced Education, Alberta Education, and Alberta Labour. Their document entitled Bullies at Work, What to Know and What You Can Do, and their tip sheet specifically for employers titled What You Need to Know About Bullying in the Workplace are extremely informative and user-friendly. Their definition of bullying includes behaviors related to vertical and horizontal violence that are not expressly dealt with in AHS documents and policies. For example, it includes making unreasonable demands, constantly changing guidelines, setting impossible deadlines, and interfering with work in its list of bullying behaviors. Also includes withholding information, taking away work or responsibility without cause, and blocking requests for training, leave, or promotion. All of these are also included in their bullying related behaviors. In a shout out to the experiences of therapists interviewed for this module, the document also identifies needing to, quote, spend a lot of time defending your actions and seeking support from coworkers, unquote, as a form of bullying. The document then lists options for responses to bullying, whether you are the target or are witnessing others being bullied. Resources regarding your legal rights as an employee are also listed, as well as a variety of other related resources. This resource, developed by WorkSafe Alberta, was developed by the Employment and Immigration Ministry and would be especially useful to persons wanting to develop a violence prevention and management program in their organization. It is not specifically designed for healthcare environments, but is nonetheless very informative, again, particularly with respect to horizontal and vertical violence. This resource defines workplace violence from the perspective of the Canadian and Alberta Human Rights Commission. Included is information on developing policies and procedures, defining and documenting roles and responsibilities, intervention and follow up, including victim support, investigation of the incident, and management of the offender, as well as a discussion of the legal ramifications of violence in the workplace. As previously suggested, the Health Sciences Association of Alberta, or HSAA, the union which represents OTs in Alberta, is also a potential avenue of help and support. Its stated objective is, quote, to have our members return home safe to their respective families each and every day, unquote. HSAA has extensive information online and, as stated previously, can be particularly helpful in the event of vertical violence. Examples of their resources include position statements on the topics listed in this slide. This resource is included even though it was not developed specifically for the Alberta context because it provides truly excellent information gleaned from the international literature. One of its greatest strengths is that it is evidence-based. Though it targets mainly nursing professionals, the information and recommendations contained therein are applicable to all health care professionals. It is the only resource listed in this presentation that considers the problem of violence in the healthcare workplace from systemic, organizational, government, and individual perspectives. Violence is viewed and described as a multidimensional phenomenon with multidimensional solutions. Importantly, it includes students as well as academics and researchers as players in its global approach to managing violence. Finally, this document includes a large number of resources for use in the development of a comprehensive program for violence prevention and management in a broad array of healthcare environments, including those who are community-based.